Good afternoon. We are located here at Tucker Vision Center, and we're going to be doing some chatting with Dr. Tucker. I'm sorry, I'm just trying to adjust this so we can see both our friends here. And there we go. With Dr. Tucker and Derek from Bausch Lomb. Say hi, guys. Is it Derek? I'm sorry.
No, Dwight.
Dwight. Oh, God.
I'm like, where's Derek?
And Bausch Lomb is B&L Bausch Lomb is a contact lens company, along with other things they do, from drugs and stuff like that.
Right. So anyway, we are going to be talking about some of the latest and greatest in correcting vision today, because there's some lots of new products out there that people might not be aware of. So let's start with you, Dr. Tucker. What is, when you're fitting people with contact lenses and things, what's your greatest concern for them?
My greatest concern is, first off, the vision should be good with a contact lens. The overall health of the eye should be good. Those are two critical things on that. So the vision should be good, the health should be good, and also the comfort of the lens should be good also. And if they're not, then you're probably not going to be a good contact lens candidate. One of the things that people don't realize with contact lenses, the changes over the last 5 years, 10 years have been dramatic. They used to be, well, if you have astigmatism, you're not a good candidate for contact lenses. That is not true anymore. You can certainly wear contact lenses if you have astigmatism. There's many varieties now that you can correct for that. They used to say, if you wear a bifocal or you need help reading plus distance, then a bifocal contact lens may not be good for you. Well, the new bifocal contact lenses called multifocals are extremely good now, and success rate is usually running anywhere from 60 to 75% on that, so they're very, very good.
So, Dwight, let's turn the floor over to you, and you can take it from there.
As Doc just said, the health of the contact lens is very important. The vision is very important, and also the comfort, which is something that Doc does a wonderful job with his patient here at Tucker Vision. He does very thorough examination to make sure that you're an ideal candidate. Also, with Doc saying that there is specialty lenses out there probably 10 years ago that might not have been so special per se for each patient, but technology is in advance over the years. So if you're one of those candidates out there that 10 years ago a doctor told you that you weren't a good candidate for contact lens, please come by and see Dr. Tucker. You'll be surprised to hear other than that, based on the technology advancement. Just to throw a couple things out there, in the last 2007, the first iPhone came out in 2007. Yes. Then the iPad. Right now we have about 6 versions of the iPhone. At least 6, right? We don't know what else is in the wings. So you see the technology has increased, and with these technology increasing, there's different symptoms. Yes. That's going on with the eyes. So Doc, why don't you tell us about some of those symptoms that you're now seeing?
Well, I think you see a lot of computer stress with the eyes now, and particularly everybody's using their iPhones, their iPads, and computer systems. One of the key things out there that is causing problems they have discovered is called blue light. It comes from your computer screens and your iPads and those type of devices, and it basically puts a stress on the eyes, particularly causing damage to the eyes in the macula, which is the area of the retina where you see your clearest, sharpest vision. Also, they have seen that if you're in bed at night and maybe you got your laptop there and you're doing something on that, and then you shut it off and you go to sleep, they are seeing problems with your sleep rhythm and going to sleep properly. That is causing problems with people. So a lot of new technology out there will help relieve that and block what we call blue light, so you have less problems with those type of things with the computer devices type things now. Okay.
That is correct, Doc. As you know, I'm a contact lens representative for Bausch Lomb, and I talk to a lot of doctors, such as Dr. Tucker, what he's seeing and how things have changed over the years. And just to reiterate what Dr. Tucker just mentioned about the computer and the digital device phenomenon that's going on now. On average, we spend 9 hours on digital devices. And this was focusing on the millennial patient base, which is around 18 to 34. But my mother is 66, and she's on it a lot too. So, she just a short story about my mother. She was complaining to me that her grandkids are not calling her. So I said, Mom, they do not call you anymore. They text you.
They text
you. Or email. So I
Right.
said, you got to get on board with that. So she's currently doing that. 68% of these digital device users report symptoms of digital eye strain.
Right.
Because we're now fixated on the computers or the laptop or the iPad, and we're blinking less. So what does that blinking less does for that patient eyes or contact
it
lens?
just creates all kinds of problems. One of the main things is, and people don't realize, your blinking mechanism is what helps moisturize your eye, and it helps you see clearly. Tears are not just water. Every time you blink, you have a mucus layer that goes on the cornea, which is a clear window into the eye. And then you have a water layer on top of that. Then you have an oil layer on top of that that helps with evaporation so they don't evaporate too quick. Now, if you're using these devices, then you tend to concentrate on what you're seeing. You do not blink as much. So then you start getting dry eyes, and you may get some superficial, what they call punctate keratitis, which is just an inflammation of the cornea, big fancy name. All those things can affect you, okay? So you definitely need, when you're using devices, you definitely need to make sure you're blinking more so your tear film is properly, but certainly with a blue tech on a lens that helps block some of those problems with the computers, that's going to make it even better. But I see a lot of people that do a lot of computer work, and their job requires their 8 hours a day doing a computer, and they're just stressed out. The eyes are just sandy, gritty. They're tired. They go home and they feel terrible.
Right.
You get the right glasses on them with the blue tech correction, and you're going to be one heck of a lot better. I see many patients that say, oh gosh, what a difference. I feel better now. So there's a lot of avenues out there. There's so much new technology out for these patients depending on what they're doing nowadays.
So what are some of the other new technologies that are kind of out there?
Well, along with what Doc says, glasses is always an option. Don't ever rule out glasses. It's always an option there. With the computer glasses, with the protected from the blue light on the computer. On my side of the industry, in my space, obviously it's contact lens wearers. For those that might want to give their glasses a rest and put on a contact lens, we do have a new contact lens from Bausch Lomb, very new to the market, came out last year. It's called Ultra with moisture seal technology. These are for that particular patient that doctor talks about that are on their digital devices a lot and obviously are not blinking. We do know that on average the eye, not fixated, blinks about 15 to 16 times per minute. But if you're fixated on a computer screen or your laptop or iPhone or any types of phone, you're going from 15 times per minute to 5 times per minute. So that dries out the contact lens. So when you go home around 5 or 6 or throughout the day, your contact lens starting to irritate and that comfort is gone.
Right.
It's due to you lack of blinking. So to go back to the Ultra with our moisture seal technology, the long and the short end of it is that we create a barrier that keeps the moisture in the lens. So if you blink or you don't blink, the moisture is still in the lens. And this is based on a technology that we can't really go into detail because it's patented, privileged information there with B&L. But just keep in mind that the moisture is trapped or is in the lens that creates a 16 hours of wear of comfort without the lens being dehydrated. So kind of diminish most of those end-of-day comfort.
That is very true. And what I see a lot of when I see some patients wearing contact lenses, they may be wearing a lens that this thing was developed 10 years ago, and they're still wearing that type of lens. There are so many new advances in lenses that are so much better for you, like the Bausch Lomb ULTRA with the moisture type seal technology on it, and many others that it's much better for you. And certainly you need to go to somebody that's going to give you the latest, greatest, up-to-date contact lens. And the other thing on that, when you look at that, and everybody's concerned about their pricing and all that, you'll find the new technologies are really competitive price, and in some cases they may be even less expensive. Okay, so you certainly need to talk to somebody that knows those and can give you the best option available to you, both for overall vision, comfort, and the health of the eye. Very critical.
You know, Dr. Tucker's being a little bit modest here as well, I think, by saying talk to somebody. He's absolutely right. The Ultra is on the market right now. Pretty much every doctor that you'll go to will have the lens ready for you. But I've been calling on Dr. Tucker for about 2 months now. And he has embraced, he's one of the doctors that have embraced the fact that there are new technology out there. You know, he's been in practice for a long time. And
over 30 years.
Over 30 years. Exactly. And he's always evolving. He's embraced this new product openly. You know, some of the techniques that he's using to introduce patients to the new product is cutting-edge technology, such as not the typical, how does your contact lens feel? Everybody's going to say fine. But he's taking a step further and asking the patient, you know, what does your lens feel like throughout the day? You know, how often are you on digital devices? And it's opening up some areas of opportunity for him to interject these new technology. And also to go along with what Doctor said about the price. And normally if you see something new, you automatically think the price is going to be higher.
Yes, I do.
All right. And with our new product, Ultra, as Doc said, it's comparable to your older material, or in some case even less. We have an outstanding rebate of $100 mail-in rebate that you get back after your purchase. Dr. Tucker has that here ready for you, as well as the new technology and the offering of it.
I do. And one of the other things we're looking on all this new technology and stuff is we're trying to get particularly children to start going into daily replacement contact lenses. So at the end of the day, they take it out, they throw it away. Next morning, they get up, open a fresh one, put it in. Because we know children don't always follow the technique and that they're supposed to, and how to care for a lens.
I think there's some adults that are that way too.
I am working with adults too, certainly the children. So I try to get the children, first-time children particularly, to go into a disposable daily contact lens. It's much better for the health of the eye. You're going to see a lot less problems with children. And when you look at the overall cost, very, very comparative to what the standard is, monthly replacement type lens. The overall cost is going to be fairly close, okay? And a little bit extra for overall health of your child's eye should be something you would be looking at as a parent.
You know, even to piggyback on that, Doc, one of the big misperception of the daily wear in the past has always been cost, like you just said.
Yes.
Cost is a factor. So we understand that all doctors, if it was up to them, they would like to have everybody in a daily. Why? Because it's more compliant, health reasons, and personally, for me, I have younger kids. I would say it's less work for me as a parent. One last thing I have to worry about. Right?
Sure.
Yeah, not like, Johnny, did you do your homework? Or, Johnny, did you take out your contact lens? Or, you know, and so forth. So I love the idea that you wake up in the morning and it's a fresh pair of lenses.
That's a fresh pair of lens.
Secure safety for your eyes, compliance reasons.
You know, and all the studies will show you that people who wear a daily lens have less problems with eye health over a period of time. I mean, there's quite a bit of difference there. So it is certainly a much safer lens health-wise for the eye. And when you look at that, particularly kids, I mean, there's no work involved. You just take it out and you throw it away. You don't have to clean it. You don't have to make sure you got the solutions on and all that. You just take it out, throw it away, open the next one, the next fresh one the next morning, and you go. And it's a nice, healthy, clear lens that hasn't been worn for 2 or 3 weeks every day for 2 or 3 weeks. It's totally fresh and new.
Right.
Very nice.
Doc, let me ask you this. Do you love donuts?
Yes, I love donuts.
America runs on donuts, right?
Yes, they do.
All right.
Yes.
So the reason why I say that, the average donut at a Dunkin' Donut is probably how much? Costs about what, $1.09, around $1
something. Dollar something.
Dollar something. The average Starbucks coffee. Nothing against Starbucks; they're great coffee makers, and But the average Starbucks purchase is going to run you well over $1.
Well,
Yeah, more like 4 or 5.
More like 4 or 5.
$5,
Okay.
right? So I say that to say this: with the daily wear, we have it now set with pricing right here at Tucker's Vision, where you can walk out with a year supply, which is 8 box of dailies, Buy a True One Day dailies, for less than $1, probably around 82 cents
About
per day.
82 cents per day.
Yes, with an outstanding rebate of $130. You're going to get a mailing rebate. The industry standard for mailing rebate, we set the bar at $130. And like you said, another factor is you can get that here at Tucker Vision daily wear for your children. To ensure the safety of their eyes, to ensure the compliancy,
Right.
And no broken glasses.
and no broken glasses.
No
Yeah,
broken glasses. Yes. Absolutely.
So Doc, I know probably run out of time here. Probably got about 5 more minutes or so.
Yeah, about that.
About 5 more minutes. Let's talk about some specialty lenses because yes, we do have the spherical, but we do have some specialty lens. Such as you mentioned it before, the multifocal or the presbyopic patient base. Kind of like myself, I'm getting there.
You're
between
getting
40 and up. I'm 41, so I'm in that area. I'm finding out my near vision is losing.
The key thing I think with that related to multifocals is going back years ago, and they weren't very good, and some people could wear them and some couldn't, but as a whole, you maybe had 15-20% that could really wear a multifocal. Right. The new technology is pushing that up to probably 65, maybe 75% that really can wear a multifocal lenses because of the design of those now are so much better. So a much greater success with that, and when you look at overall cost, the cost is really reasonable.
Right.
Okay. Depending on what you're after, obviously, and a lot of people hate their glasses, so you wear a multifocal, and it does the job. So that's some new technology out there that's good. Certainly, the technology of the Ultra lens with the holding the moisture in on those, because we've had problems with contact lenses in the past. The longer you wear those during the day, where they get a little dry and irritated, with the new technology, it holds more moisture in, so your comfort is much better.
Awesome.
So those are some of the technology things that I see out there that are very good.
Now, Doc, the presbyopic population is a very unique population.
Yes, they are. They're old people like me.
And I'm getting there.
And you're getting there, okay.
And it's kind of challenging to please them at times, because I do want to see like when I was 20 years old. Okay, how do you identify who is a good candidate for this space?
Well, I think you have to look at that patient that is motivated, really wants to wear contact lenses, does not want to wear their glasses. And then a lot of times you have to look at that patient, they're motivated enough, but they're also willing to compromise a hair. In most cases, if you think you're going to see as great with a multifocal as a pair of good bifocal progressive lenses, it is probably not going to happen. If you're looking for that type of thing, it's probably not going to happen. But most people don't look for that. Most people will give a little bit of compromise. Well, my vision's not 100%, but it's 98% or 95%. They're willing to accept that for the convenience of a multifocal lens, because they can do about 99% of everything they want to do, and they're perfectly comfortable with that. And that's what you have to look at. And I think if you're looking for, well, I want to be just like my glasses, is not going to happen, folks. But if you're willing to compromise some, great lens.
Right.
Great lens for you.
Awesome. So for you out there that are in this space of presbyopic patient, and 10 years ago, maybe somebody told you that, contact lens is not for you, and you feel stuck, for lack of a better word, with your glasses. Come and see Dr. Tucker at Tucker Vision. He does have new technology for you. He can get you in a pair of multifocal or presbyopic lenses that will allow you to see far, near, and in between. But be very sure that you do have to be realistic about what you want,
what you expect.
Expectations are. But Dr. Tucker can probably get you up to that 85, 90 percentile, seeing and having good visual acuity with these multifocals that are currently on the market.
Yes, you can.
And the price is right as well. So he's not going to break your pocket. He's guaranteeing you patient satisfaction overall. And come and see Dr. Terry Tucker with your needs.
All right, Dr. Tucker's located at 88 Pine Island Road in North Fort Myers, conveniently located between the 241s.
Yes.
For those in the Southwest Florida area, and you can find him on Facebook and Twitter and all these good kind of places. So he's an expert in the area, which is why we wanted to have this conversation, was so that people can be informed. And they know they have options, and
with that
get accurate information, I guess you can say.
Yes, you will.
Yes.
You will.
Yeah, you're right. You're brutally accurate sometimes.
Well, that's good. With that said, we want to give you a phone number just in case you can't come by today, but you can always call. We have a wonderful staff here headed by Susie up front. We have a great staff here. You're going to feel very comfortable. That's also very important. We talk a lot about what you provide in terms of contact lens and glasses and your different area of expertise. But we fail to remind the
I think
folks
I've
about
got
the
a
staff.
great staff.
Right,
I really
great staff here. Come experience it. Don't take our word for it. But you can reach Dr. Tucker at 239-656-1778. Give us a call. Make your next appointment. Especially now at the beginning of the year, you have insurance. You take various insurance. What is some insurance that you take?
Well, we take VSP, VCP, IMED, oh my gosh, of course, Medicare, Visas, it just goes on and on. The key thing, if you have any questions, call the staff and they'll be glad to tell you if we take your insurance or not. But we pretty much take everything.
Well, that's awesome. Here at Dr. Tucker, where vision matters.
Ooh. Helping you see all the colors of life. It's another one. Thanks to all our viewers, both live and those that will be watching this on the replay. What's Up Southwest Florida will be periscoping from time to time, different things going on in Southwest Florida, as well as different local authorities in our area sharing their business expertise. So thanks for watching. Bye now. If I can get this to flip down.